Hi, thanks for tuning in to this introduction to sclerology. I would really appreciate it if you would take a moment to like this video and drop a comment below to let me know what you thought of it. Thanks.
Well, I think we should get started. What do you think? That sound good? If you think it's time to get started, give me a thumbs up. Let me know you're ready for this. All righty, so today, welcome. We are talking about sclera indicators. Now, we don't have time to go into every sclera marker there is, but we want to look a little bit at sclerology because it is often considered the lesser known cousin for iridology. We have a very worldwide audience today. We are going to look today at sclerology, and we're going to look at it because so often we get focused on the iris or we get focused on the pupil. But we also know that the sclera, the white of the eye, gives us information, and it gives us different information from what the pupil and the iris give us. It also gives us corroborating information. It helps us to understand things at a deeper level. As we do this, I want to remind you that this is for your education only. We never use iridology to diagnose or prescribe. That's probably one of the first things that I have to correct with every student coming in, is they think that we can look in the eyes and name diseases, and we cannot do that, and we do not do that. You are responsible for any results, good or bad, that come from using the information I share with you today. So as we talk about sclerology, I'm going to ask you, particularly if you already have iridology, to consider how adding sclerology to your iridology practice will help. For those of you who are brand new to the idea of looking at the eyes to gain information about the body, I'm going to ask you to just consider, how could you incorporate this into what you already do? How can you use this in your skill set to enhance your business and to help you help your clients at a much deeper level? I want you to think about how you want to do an analysis with your people. Do you like to keep it really surface, regardless of what you do? Are you simply putting band-aids on problems? Or do you prefer to create individualized programs at a deeper level that work on the root of the problem? And actually, I would like to see an answer to that in the chat box. Do you prefer working on symptoms and just making people feel better? Or do you prefer working at the root of the problem to actually take care of bringing the body into better balance? So we've got, Paula is saying she likes to work on the root. Excellent, excellent. And Peggy is saying root as well. That's fantastic. So is Terry. I love this. Good, good. I prefer working on the root if the person is also willing to. Alexandria, that's a very good point. So often our clients come to us with that shopping list of symptoms. They think the symptoms are the problem. The symptoms are really the inconveniences of life, correct? And they think that if they take care of the symptom, everything will be good. Sometimes when we're working with our clients, we need to work on the symptom to help our client be comfortable while we are working on the root to really get the desired long-term change. Does that make sense? Does that make sense? If that makes sense, give me a makes sense in the comments box. Peggy is saying yes. Fantastic. Okay. So let's take a look at an eye. When we do iridology, we are looking at the iris. We are looking at the colored part of the eye. Our training may include assessing the pupil. And if we're lucky, our training has included looking at the sclera. For many people who've learned iridology, they've only learned the iris. They have not learned the pupil or the sclera. Today, we're going to focus on the sclera. Michelle Davies is with us as well, and she's a certified iridologist. She has completed my course, as well as one with some with David Pesic and some with Darko Purse. And she actually came to me after doing David and Darko's courses. So that was exciting to have Michelle. Good to see you, Michelle. Remember that the iris itself is primarily inherent. The pupils also are inherent and dynamic. We see both inherent and dynamic indicators with the pupils. The sclera is primarily dynamic. Now, you know the sclera is dynamic. By dynamic, we mean it changes fairly easily. And you know this if you've ever had a really ugly cry, right? If you've had a really ugly cry, your eyes have gone bloodshot, and you've probably gone to the washroom, splashed some cool water on your face, patted your face dry, and stayed there for a few minutes while the blood vessels in the eyes settled down, right? And that these blood vessels in the whites of the eyes can be just that, responsive. But what about blood vessels that have been there for a while, that aren't there as the result of an ugly cry? What information do these blood vessels give us? Let's look at a few specific types of markers in the sclera and talk about what they are. Now, sometimes the markings are very clear and they're very standalone because they are very situational, and that's what we're looking at in this particular eye. This is two different views of the same eye. A young client, 17 years of age. I have actually cared for her and her family since before she was born. At the age of 17, her mother brought her to me because this young lady was recovering from a concussion. And her mom wanted to know if there was anything I could do holistically. They were also under medical care because it was a very serious concussion. It wasn't just a little tap on the head and I'm dizzy for 10 minutes. This was something that actually put her in bed for a month. She had problems speaking, reading, connecting thoughts. This was a serious concussion. What we see in here is what we call a trauma fork. This fork right here. You can see it's like a sort of an upside down, half sideways Y. We've got the leg of the Y and the branches of the Y. So what this trauma fork tells us is, it tells us, number one, there has been a trauma, and it could be physical, it could be environmental, as in a toxic environment, it could be emotional, anything that is really significant. In this case, it was physical. When we take the leg of the Y and we extend it straight in, we were to extend that right in, that points to the area of the body that suffered the most from this trauma. Now, this is sitting in that upper brain area, right? And the width of the arms show us how far-reaching the trauma is. Okay. Now, unfortunately, she moved out of the city, actually out of the province, just a month or two after we did these photos. So I haven't been able to get follow-up photos with her. At any rate, she had, and I don't have her photos from prior to this because we had never needed to do photos with her. I knew the family history well and could just work with that. But we do have this trauma fork that her mother says was not there before the trauma. And it indicates that there was a serious head impact that reached well into the brain tissue. And she did recover. She has since graduated high school, gone on to 2 years of post-grad doing a diploma in fashion, I believe, and has moved on from there. But again, I don't have follow-up photos to show if that has receded. Now, here's the thing. While the sclera is dynamic, this may still be there. With all of the right work, we may be able to reverse this. But even with all of the right work, we might not be able to reverse this completely. And if we can reverse it some, that's good. But if we can't reverse it completely, it will remind us that this area is an area that has had a significant trauma and could be at risk, again, for a more serious issue if she ever has another similar head impact. This is, when we look at this, and I don't know if you'll be able to see this clearly on your screen. One of the things that medical people watch for in the whites of the eyes is called jaundice, and it is where we are looking to see if how the liver is functioning. And so we're looking to see yellow, jaundice from the French word yellow, jaune, right? And so we've got some yellow here and a little bit of yellow creeping in over here as well. When we see yellow in the whites of the eye, it tells us that bilirubin is not being properly conjugated for excretion, and it's building up in the bloodstream, and that makes the eyeballs appear slightly yellow. So when we look at this, we also need to then correlate this back to the iris. We need to ask the questions first, have you been tested? Has the doctor ever mentioned anything about liver function with you? Is there any reason why your liver might not be wanting to be happy here? And then we want to also be looking at the eye to see if there are any other corroborating marks. Remember that the iris map is not cast in stone, right? It is not cast in stone. The iris map for each individual is slightly different, so we have to be willing to kind of roll with the punches here. What I'm looking at is right here, we have a transversal sitting in the liver zone, which suggests that inherently there may be some questions about liver function. Not a guarantee of, but certainly wants us, when we combine this with that slight bit of jaundice, this all wants us to ask about liver function. So we're going to need to ask about health history. We're going to need to ask about diet and about lifestyle and about supplements they're taking. Now, this is an older fellow. He doesn't drink alcohol. He does take supplements, and he is not on any medications right now. But his liver is clearly still saying unhappy. Now, there's some other things in here that we won't get into that tell me that there's some ongoing dynamic things that could be supported. But for the moment, let's just focus on the jaundice. Because I'm not a medical doctor, I cannot diagnose jaundice. So I would look at these eyes and I wouldn't call it jaundice. I would say to him as I show him his photos, there's a bit of yellow showing up in your eye here. Often that suggests the liver could be unhappy. I have to refer you back to your medical doctor and suggest that you ask your medical doctor to run a liver panel on you, right? And then my client can go to the doctor, get the liver panel, doctor can interpret those, my client can bring those results back to me, and we can talk about what to do. Now, some really simple things we can do that we can recommend that are really easy to help that liver do its job a little bit better. If I'm right, and this person's not conjugating bilirubin properly, sunshine is one of the best things that we can do. Get them literally out in the sunshine for 15 or 20 minutes a day, face exposed. If the weather is warm enough, it's not warm enough where I live right now, but when it's warm enough, to get out there with a little more skin exposure, arms and legs perhaps, that would be good. We also want to make sure he's drinking enough water. Very simple recommendation, very simple. We also want to make sure he's getting enough sleep. And we want to make sure that he's not eating foods that stress the liver. So Peggy is suggesting perhaps vitamin D with K2. That may be another viable recommendation for him. Another marker that we look for is called a meander. This is a meandering vessel. You can see it looks like a little river meandering through the countryside. So when I'm looking at an eye and I'm doing the sclera and the iris and the pupil, my very first question is always, what would you like my help with? What are your health concerns? And so I'm going to start first checking the iris because that's going to show me what their genetic tendencies are. Then I'm going to look at the pupil to see if that's giving me any indication with any flattenings or any unusual shaping to the pupil. because that will also help me to understand what's going on here. And then I'm going to look at the sclera. And when I look at the sclera here, I'm seeing this meander. And this meander is telling me that there is likely some congestion in the circulation in the organ that is directly in from here. So I would map this, and we're looking at this inner edge of the eye. This is where we're picking this up right here, right? And so everything that's right in here is what is going to be our concern. So our conversation here is going to, again, revolve around his history, his diet, his lifestyle. And then we are going to get specific to talk about what has the doctor said, or what has he noticed himself about his circulation. We also see in here that there's some darker shading, some gray-blue shading that gives us more information. But we want to focus where we see this is a very systemic marker, this gray-blue. This is a much more direct marker showing us which organ we need to be really focusing on. If we do enough of the right kind of work, we may see these blood vessels soften. We might see them pale out and become less significant. When they're pale and thin, they're a problem that is setting up, probably subclinical. When they are thick and bright, it is something that's very active right now that probably needs some attention. Little harder to see on this eye, but on this eye, we have what are called Pinguecula right here and over here as well. Pinguecula are typically benign. They usually happen at 3 o'clock and 9 o'clock in the eye, and always on the whites of the eye, of course. These are a protein, fat, and calcium deposit that happens usually because the liver is unhappy. So when we see these, particularly if they're yellowish, as these are ever so slightly yellow, it tells us the liver particularly is unhappy and there's probably a higher fat content in here. And so we want to take that information and again, tie it back into what the client has asked for help with, and see if there are any other iris markings or pupil markings that talk about that type of a problem. And then, because remember, the iris is what they are genetically prone to. The pupil tells us genetic and dynamic, and the sclera gives us dynamic. So we see here that she is prone to liver imbalance. We've got lots of indications of liver imbalance there. Not that she has it, because the irides show us inherent potential, but that she is prone to it. So we want to see what symptoms does she have that supports that, or has she had any diagnoses from the doctor that support that? And then when we see the Pinguecula in the sclera, that again teaches us that the liver is probably very unhappy. Now, this is one thing that we cannot dissolve. Once it is deposited on the iris, we cannot take it away naturally. They can be surgically removed, but there's a high risk of them growing back, particularly when we know there is that undercurrent of liver predisposition already. Is this making sense for you? Any questions on anything so far? Peggy says it's making sense. Peggy, this should all be just a solid review for you, just a lightweight review. And Paula's saying it makes perfect sense. Amazing. Sergio is loving this as well. Fantastic. So with that, I'd like to, before we look at a few more eyes, I'd like to introduce myself now that you've heard me share some good iridology information. I got into holistic healing over 4 decades ago because I had health problems that the medical world was not isolating. They weren't pinpointing. They weren't helping me at all. And the problems weren't serious. They were just uncomfortable and inconvenient. I was raised in a very medical model home. Doctor knows best. Doctor knows everything. You do what the doctor says. And so as a young adult with a little bit of a problem with authority figures, I decided that doctor did not know best. That doctor probably didn't know what I needed him to know. And that is when the whole world of holistic opened up. I met a young man who knew a bit about herbs. He knew a bit about nutrition. He knew a bit about iridology. He knew a bit about biokinesiology. And he started teaching me those things, and I fell in love with him, and we got married. And that romance continues to this very day. But I ran with what he started me on, and I've studied hard over the last 4+ decades in order to get to where I'm at and to be able to teach what I teach. Along the way, I have become an IPA certified level 3 iridologist. That is the highest level they have. The last time I checked, there were only 5 level 3 certified iridology instructors in the world, right? And I am one of them. I've written several books, self-published, self-distributed. They are all out of print right now. Pregnancy Naturally, the Herbal Birth Kit Handbook, Healthy Kids Naturally, The Essential Guide to Nature's Sunshine Products, Biokinesiology and Color Therapy Level 1 and 2. The only one that's not out of print, and it is available digitally to my students, is the Confident Nutritionist Dynamic Iridology Textbook. I've created courses to go with pretty much every textbook I've ever written. And I will be offering you an invitation in just a few moments. It looks like Paula's had the same experience I had with the medical world, where she was not getting the satisfaction she asked for. I am also a trained nutrition coach and have professional affiliations with the Canadian Association of Holistic Nutrition Professionals and the Canadian Association of Natural Nutrition Practitioners. And I am also a master herbalist and a member of the Alberta Herbalists Association. So when I teach in the scope of a course, I very much incorporate nutrition and herbology. Peggy is saying, we thank that doctor because Judith is so wise and knowledgeable, so blessed to have her as our teacher in all these categories. Thank you, Peggy. And Paula says, well, wow, you're amazing. Thanks, Paula. Thank you so much. Here is another client. Let's take a look at this fellow. This is an older fellow. He's 79 years of age. He's been a client of mine for about 7 or 8 months now. He started coming to me because his first concern was he had excess abdominal weight. And that's what he wanted to get rid of. He really had a very large belly and kind of skinny arms and legs. His weight and actually a few other things that the doctor hadn't talked about with him was affecting his knees. That was causing pain and affecting his ability to walk. So he had become very sedentary. He had prostate cancer that had been treated with radiation and hormone therapy, which he still suffers side effects from the hormone therapy. He's had congestive heart failure. He has an irregular heartbeat, shortness of breath, and acid reflux with heartburn. When we met, he was on 6 different medications, including an anti-anxiety medication that was supposed to help him stay relaxed, because he found that when he would get a hot flash from the hormone therapy, and that would make him get really anxious, and then he would stop breathing properly, and it wasn't a good scene. But, you know, when we look at this, there were symptoms in that list that also correlate to a hiatal hernia. The irregular heartbeat, the shortness of breath, and the reflux or heartburn tie directly into the risk of having a hiatal hernia. Now, his doctor didn't diagnose him with that, and I can't diagnose him as that, but I suggested that he get looked at for that, and I did suggest some little things that he could do in case this was a problem. When I look at his eyes, I see some markers that led me to believe, along with his symptoms and his weight gain, that he likely was playing with insulin resistance, and that could have been a part of his weight gain. I also noticed that he tends to have an excessive, a predisposition to build up too much acid, not in his gut, but in his tissue, in his blood. Actually, his gut, I would suggest from his eye photos, suggests that he probably doesn't have enough digestive acids. We see in his eyes that there are gray patches. We've got lots of gray patches. We've got a Pinguecula again forming right here, and another one here. We've got these fermentation signs, again in the sclera. Now, moving into the iris, we have a corneal arcus. We're going to tie all of this together, and we've got this pigment right here. Now, that pigment is, the color of it suggests liver and pancreas want to be issues, right? And that's an important observation because the placement doesn't tell us liver, but the pigment color does. We've got a little bit of dirty yellow scattered throughout. And there are recent studies that suggest that uric acid, which this yellow suggests his body genetically wants to build and hold on to. Recent studies show that uric acid is a key player in both insulin resistance and cardiovascular issues. Interesting. So he got some lab work done and brought that in. His hemoglobin A1C was 7.7, which is too high. That is definitely in the type 2 diabetes range. And I can't tell him that, right? But I know that it is. And so I would never say, you are definitely insulin resistant, type 2 diabetic. I would simply say, when a doctor looks at a number like this, they are probably going to want to talk to you about the risk of you being type 2 diabetic. Now, do you see how carefully I worded that so that I didn't diagnose anything? I simply planted the seed that there could be a problem. His labs came back also with low leukocytes. His lymphocytes were low normal. His hematocrit was very low normal. His erythrocytes, those red blood cells, were low. His testosterone was very low, and that is a result of the hormone treatment that they are doing with him to prevent the prostate cancer from coming back. And he had elevated triglycerides, which again suggests an increased risk of insulin resistance as well as some dietary issues. So as I took all of those markers and put them together, so what we see in the sclera, what we see in the iris, I didn't even get to the pupil with this fellow. His initial program, I suggested that he look online and find some YouTube exercises to work with hiatal hernia in case that's what the osteopath would find. I didn't tell him he had hiatal hernia, but I suggested wouldn't hurt to do those simple little exercises in case that's what the osteopath finds. I also suggested that we wanted to maybe use some berberine IR, so some berberine formula for insulin resistance, because it also works on the liver. I suggested a glucosamine blend for his joints and for his gut health. Often we think of things like chondroitin and MSM and glucosamine as just being joined, but oh my goodness, they're so good for gut health as well. And I suggested omega-3. Now his breakfasts were pretty awful. Breakfast was typically a rice cake with peanut butter. And his whole diet was, he thought he was doing the right things to lose weight, low calorie, but he didn't understand that low cal, high carb will keep the weight on and will perpetuate insulin resistance. So we got him to replace, very much against his will at the outset, his rice cake and peanut butter, got him to replace that with eggs and vegetables. It was interesting, 2 weeks after his first appointment, when I sent him a little email just checking in, seeing how things were going and reminding him of the homework we discussed, he said, if anyone had ever told me that I would like having eggs and vegetables for breakfast, I would have told them they were crazy, right? But he loves it now. We've given him lots of ideas for how to make that happen, so it's not the same thing on his breakfast plate every day, and he's loving it. We also got him to add more vegetables to his diet, especially the kind of veggies we would put in a stir fry. He is loving that. And I suggested walking for 30 minutes a day. Now, here's the problem. His knees were sore. For him to go for a 30-minute walk wasn't going to happen. So we started where he was at. And I said, could you walk for 5 minutes after each meal? That was doable. And it didn't take him long to strengthen his legs, to get to the point with the diet work we had done where we were starting to reduce his tissue acid, which means we were reducing inflammation, to where he was starting to walk 10 minutes after each meal. Now he does 2 20-minute sessions on his treadmill because it's a little too cold and icy to walk outside where we live. I also suggested sleeping on a wedge pillow. So making sure that he had that firm support, making sure his butt was right at the bottom of the wedge so that his whole back was supported all the way up. And he says that is the very, very best thing for sleep for him. He is sleeping so well for sleeping on that incline. It's really reducing any reflux. It's helping him to breathe better. He was finding that when he would lay down with the belly weight, that would impair his diaphragm. Sleeping inclined, he is breathing so much better. On his last appointment with me, he said, you know, I haven't really lost any weight, but I'm losing inches. He said, my clothes are fitting differently. And he says, my tummy isn't hard anymore. And so we've been able to start correcting things. My feeling with him on his gut, having worked with people who've got heart failure, is that it's not fat on his abdomen. I think that what's on his abdomen is probably ascites. And so we're working with ways to help him flush the fluid more effectively. Paul is asking thoughts on it's not really intermediate fasting. I know what you mean, and the word escapes me. Depending on a person's health, I do not like intermittent fasting. That's it. I do not like intermittent fasting as a general rule. Too many people where I live are too stressed. And when we intermittent fast them, they don't follow the rules properly. And it creates further adrenal and thyroid stress. And so it's too complicated for them, because they are not only restricting when they eat, but then they've got to make the right food choices within that framework. So I always start with the food choices first. And I find that with that, I don't need to go into intermittent fasting with them. It's such a fad right now and I don't know that it is sustainable for the long term for a lot of people because of that. So at any rate, this gentleman, he is loving what we're doing. When I ask him for labs, he always says, how come my doctor hasn't recommended this yet? How come my doctor didn't ask for these labs? You did, and look at, you're finding imbalances. And it's like, well, I just see things differently. So Paul is saying she's been doing intermittent fasting for years. And for some people, it may be appropriate. I do not think it's appropriate for the masses. And I also see that people's bodies change over time. What was good for them 5 years ago may not be good for them now. So I always encourage my clients to work with nutrition, understanding that their body requirements will change, both for food types and timing of those meals. So I don't want them to lock into a hard and fast program ever. So I'm glad it's working for you. But again, it's not something that I recommend carte blanche to people because I don't see the results. People come into me intermittent fasting, and I have to get them off it in order to get them well. So, you know, as you've seen some examples of some of my clients and some of the work that we do with iridology and sclerology, because that was our focus today, a lot of people want to learn iridology, right? And they want to do it because it's just a fabulous tool. Other good reasons are it helps you assess your clients more quickly. It helps you laser in on what needs to be done. What are their concerns? What do you see in the pupil, iris, and sclera? What questions does that make you want to ask? What are the recommendations you need to make now based on all of that information? And you can gather that information so quickly. I can do a first appointment with a client in under 75 minutes, right? That includes taking their eye photos, popping them up on the screen, gathering their history, doing the iris assessment as far as it needs to be done to get them to the next level of health. Iridology helps me to be more accurate. It helps us to create better and faster rapport. I never use a lengthy questionnaire. I use the iridology as my intake. It guides the questions I need to ask. And because I'm asking questions that are specifically relevant to my client knows I've heard them. They don't feel like we're meandering all over the place. Many years ago, I was taking my son to the doctor to discuss a particular problem, and I had his younger sister with us. And the doctor pretty much ignored what I was there for about my son and fixated on a problem he thought my daughter had. Now, it's the first time he'd ever seen my daughter. He'd never met her before. This was a new doctor to us, and he fixated on this problem. And I knew she didn't have that problem because I knew the problem he was talking about. I followed it up with another professional, another doctor who specialized in that problem. And that follow-up doctor said, "You're absolutely right. There's no problem here. I've worked for 45 minutes with your daughter to try to make that problem manifest, and it does not exist. Who was it who told you?" As a result of that, we have never been back to that first doctor because he had no rapport. He wasn't listening. When I use iridology, my clients know I'm hearing them. And again, iridology eliminates the need for an intake form. It does not eliminate the need for an informed consent form, right? We still always do informed consent. Critical that our clients know our scope of practice so that they cannot come back on us and say we were practicing medicine without a license. The dynamic iridology course, and this is an invitation for you, starts again on March 15th. This is an iridology course for health professionals only. I only accept people into this course who have completed anatomy and physiology before they get to me. It is the only live, online, fully mentored course for nutritionists, herbalists, naturopaths. Let's add in registered nurses because I've got lots of nurses coming in, physiotherapists who want to expand their practice, anyone who's got A&P under their belt, so they can stop working unpaid overtime to develop client programs, so they can stop overwhelming their clients with programs that are just too big to manage, so they can increase their client compliance, and so they can increase client success and long-term retention. So again, this is only open to people who have completed A&P before they get to me. Now, if you are interested in iridology, but you don't have A&P, reach out to me. I will send you a link to the very best A&P class course I know of. Get that done, then we can have a chat. So, why is this not advancing? There we go. Again, you've got to have your A&P. This course is open to you if you want to learn iridology and sclerology at a professional level. It's open to you if you want to learn how markers play off each other. So many courses teach you marker names and they teach you how to use a map, but they don't teach you how to correlate the markers. You saw me do that where we talked about yellowing in the eyes, seeing liver pigment in the eye, seeing different things. And Paula, you are a certified iridologist, and you certainly if you've got A&P under your belt, you are included in the health profession list that can use iridology. So yes, this can apply to you. Absolutely. This is for people who want to learn what questions the eyes want you to ask, so you can let the eyes guide your intake process and your assessment process. This is for professionals who want to learn how to create programs your clients can be more successful in implementing? How do you create a simple, concise program instead of everything they need to know for the rest of their life program? That is what we teach in here. And you want to be mentored for the long term. And by that, I mean years, not just when you're enrolled in the program. Peggy is a course graduate. Angela has just finished the course. I'm just looking at people who are attending here. Michelle Davies is a course graduate and certified iridologist. So Theodora is a course graduate, and they are still they're still coming to the support that we have. Natasha asks, are you able to assess clients online or in person only? You have to be able to get excellent photos of their eyes. Now, if they can do that with a smartphone and a macro lens on their smartphone and send those to you, then you can do it virtually. Otherwise, you want to do it in person. You need good photos. There is not a camera that I've seen yet that works well over the internet to actually get in close enough to keep the eye in focus. Peggy says, love the course, highly recommend it. Thanks for that, Peggy. So if you are interested in this, if you want more information, if you want to know all the course details, then you want to maybe have a chat with me. I'm pasting the link in the chat box. Michelle says, Judith's course are really amazing. I signed up today to hear my best teacher as I really miss you, Judith. You are so inspirational and uplifting. Thank you, Michelle. You can make me cry. Thank you for that. It's probably these are lovely comments. Thank you. And so seriously, if this sounds like how you want to learn iridology, you want to learn iridology, you want to incorporate pupils, and especially for those of you who do the physical work like physiotherapists, the pupils are really, really important there. If you want to learn how to use sclerology with it, then we should have a chat, because all of that is included in the Dynamic Iridology Assessment System course. And so you've got the link in the chat box to schedule a time to talk with me. That's the only way you can register, is by having a conversation with me. This is not a high pressure sales call. This is truly a conversation to see if you and I are a good fit, if this course is a good fit, right? And if it's not a good fit, I'm happy to coach you in a different direction. If it is a good fit, I'm happy to invite you to enroll into the course. So whichever is the best for you is what I want. And so with that, my friends, are there any other comments or questions that anyone wants to ask here about what we've talked about, sclerology? Any general questions about the course? Any questions about incorporating iridology into what you already do? Those are questions we can actually include into the phone call when we schedule a phone call. And Peggy says, thank you, miss you, look forward to the summer course. I hope we have the summer course, Peggy. We're hoping for it. And Natasha's saying, how long is the course and the price, please, Natasha? We'll talk about that in a phone call, please. I like to give those kinds of details when I know that it's a good fit. So just a simple Zoom call, and let's get all your questions answered. Angela said, I just finished my iridology course. It was awesome. Judith is a great teacher. I'm getting ready to learn more from her about sclerology. Fantastic. Alexandria says, I've seen in some people's iris there can be brown coloring. And what does that indicate? Brown in the iris. Alexandria, you've got iridology training, have you not? Didn't you already have that? Just let me flip back here. That's basic constitution. And so that is always suggesting liver predisposition if it's in the iris, right? And so that again for us is, what is that? Students, graduates of mine, that is what, about module 4 in our program, module 4 or 5, where we talk about the different colors that you see in an iris and what the colors mean and what the placement of that means. Oh, she means sclera. So brown in the sclera, it depends on where the brown is, and it depends on what the base color of the eye is, what your constitutional color is. So it's not a simple answer. You have to know what your basic constitution is and where the placement is to know if you even need to be concerned about it. Angela says, also looking forward to her herbology class too. Thank you, Angela. Well, that herbology class is probably going to be the next one I offer for my grads. So you can watch for that coming up probably in the next 2 to 3 months. We might be starting that. I'll get that out. Michelle says, I'm saving my money for level 3 IPA with you and can hardly wait. Fantastic, Michelle. Looking forward to that again in the near future. Amazing. Love this. Fantastic. So I hope I have answered questions. What does the little gray black dot in the sclera mean? Little gray black dot. The gray cloud we saw, or if it's a little dot. Again, it would depend on if it's truly black or if that's a photographic thing, because it might not be black, it might be red. Okay, so again, it just depends on how good the photography is. And so with that, it would depend on, is it red and where is it sitting? Or is it black and where is it sitting? And definitely not red. Okay, so black, again, I would need to see the photo because I need the context for it. We don't assess marks as standalone marks. We need context to understand everything that it means. We need to also understand that photography is really inaccurate for color reproduction. And even with high quality equipment, every computer screen manifests color differently. Every camera shoots color differently. So I have to see the photo, understand the history to be able to assess what that means, right? Fantastic. With that, my friends, I am again, let me just get down to, oh, a couple more things in here. How did I not do this? Okay, so we've heard lots from my students already. Let's just do this really quick. Next course is starting on March 15th. And again, you only get in by having a chat with me. So if you have questions about the course, let's talk. If it's a good fit, I'll invite you in. Sky Fibke actually was not able to attend the courses live because the class is taught by live webinars. She could only attend the recordings because of her work schedule. This is what she said. I could not have asked for a better layout for learning. I was unable to make it to the scheduled classes, but the recordings of the classes were amazing. I loved the weekly quizzes. I am glad to know that I always have you and my Iridology community to turn to if anything ever comes up where I may be challenged. Thank you for being a part of my journey and for all the support provided. You did not miss one detail. She is a master herbalist. This is Dawn, who is a nutritional consultant with her training from CSNN. She said, I would like to thank you so much for all you've done to help me on my iridology journey. I appreciate your teaching skills, your follow-up and your availability, and all the time you spend presenting and marking. I am blessed to have you in my life. She's just getting her nutrition practice up and running. Karen Choate is a graduate from I believe it was Trinity, and she also specializes in gut health. She says, I just returned from a regenerative detoxification course where iridology is implemented. I spread the word about what a wonderful teacher you are. Most people I talked with did not have anywhere near the same experience with their iridology education. They had no support, unanswered questions, and a lot of confusion. Mostly they finished their classes not knowing how to implement what they had learned. I feel so absolutely blessed to have been taught by you. I feel totally supported, even still, as I've graduated almost, I think it's 3 or 4 years now ago. I don't think there's anyone out there practicing, educating, and teaching iridology like you. Thank you from the bottom of my heart. I'm eternally grateful for your never-ending patience and support. So with that, again, the course itself, oh, here, answers to some of the questions. I'm sorry, I didn't realize I had all this in here. The course is 22.25-hour long live webinar classes. We meet once each week. The classes are recorded, so you can review or study on your own time, right? Life gets in the way. If you have to miss a class or all the classes, no big deal. You've got the recordings. We have 2 live online 1-hour mentoring sessions per month. So these are extra. They're included in your tuition. Use them if you want. Bring cases, bring questions. And this is where you get your extra support from. We have mentoring that continues even after the course is complete. You can keep coming to these mentoring sessions for as long as you want. You receive also a 225-page downloadable digital textbook included with your tuition. And it is always the most up-to-date version of the textbook in case I have to edit or tweak it. 45 pages of downloadable cheat sheets. This is the whole curriculum in a nutshell, 45 pages of nutshell. We have small class sizes. I limit it to 10 students per cohort. I want to make sure that you have all the attention you need to get all of your questions answered. And I mentor you towards certification. The curriculum I use is approved of by the International Iridology Practitioners Association, and they have set steps that you have to go through to become certified. Doing the 20 classes is not enough to be certified, as in it's the curriculum, but it's not the practicum. And so this mentoring is the practicum session. Paula, thanks for being with us today. And so there's a payment plan available. And again, we'll talk about that on phone call, on the Zoom calls when you schedule your call with me. Again, the course is starting March 15th again, and we've got the link here in case you missed it the first time around. Feel free to schedule a time to chat with me. Let's make sure you get your questions answered to decide if this is a good fit for you or not. If you want to learn sclerology, iridology, and pupil, and how they all work together in an iris assessment. I must run. I have a cohort, a class starting in just 7 minutes. So I look forward to speaking with many of you soon. And thank you, grads, for being with me today. It's so good to see you again. I don't see enough of my grads. I really adore my grads, and I adore all my students. So schedule that call. Let's talk about the course. Let's see if this is the right course for you, if it's the right time for you, and let's get moving forward.
Hey, thanks for watching. And again, just take a moment, if you would please, to like this video and drop a comment below. That ensures that more people will get to see this video. Thanks so much. Bye for now.